Let's talk about what is going on with lockdowns. Are we going to have a full lockdown? Aren't we going to have a full lockdown? Tiers 1, 2 and 3 is all change again, we fear today. Well, let's talk about it all with former leader of the Liberal Democrats, still an MP, Tim Farron. Good morning to you, Tim.
Good morning, Julia.
Very nice to speak to you. Do you agree with Keir Starmer that we need to have well, he calls it a circuit breaker. It is actually a second lockdown. Or do you agree with the Prime Minister's current stance today, who knows how long it will last, of having different tiers of lockdown restrictions in different parts of the country?
I think the sage advice, which I understand the leader of the Labour Party supports, and so do we, is that we would have a 3-week, it's been called a circuit breaker, to deal with the exponential rise in the pandemic at the moment. And my sense is that if you look at everything that's happening now, you can't look at those graphs and think they're not going to end up in horror in a very short period of time. We're probably about a fortnight away from having more people on intensive care beds than we had back in April. 20,000 new cases yesterday, 137 deaths. 1 in 3 people with COVID-19 are not being contacted, and only 20% of those people who are actually self-isolating, we believe. And so there's no doubt whatsoever that it's a complete nonsense to think that doing what the Prime Minister is doing now is somehow going to protect the economy, when maybe in 2, 3, 4 weeks' time anyway, we could be in a far worse situation than we were in April.
Except
it makes sense to follow the advice now.
We're following, we're told, the trajectory of Spain and France. Patrick Vallance said that when he showed us his graph of doom on the 21st of September. We're nowhere near the rate of infections he was talking about. We know that Spain, their rate of increase is now plateauing off. We know that's happened in France. In a lot of countries, it's very predictable. Whether you've had great test and trace and kept your numbers down, or whether you've had a full-on lockdown like Spain, or all the different countries doing completely different things. Everyone's got a surge in the virus right now. Well, of course they have. It's the autumn. We do see more people with respiratory illness at this time of year, more people going out and about, more people obviously also in their homes as well, meeting in homes rather than in the park because it's not lovely and warm and sunny anymore. This was entirely predictable. It is normal. We see this every year. And we also know that an awful lot of the people who are in intensive care, I mean, certainly the Carl Hennigan, they've done an estimate that something like a fifth of those people who are currently in hospital with coronavirus, they've actually only tested positive a week after they've been in hospital. So they've caught the infection in hospital. Many of the people who are dying with coronavirus on their death certificate, dying of other things, long-standing health complaints, major issues they've had for many years, but they've now tested positive for coronavirus, therefore it goes on the death certificate. There is a danger that we are getting a little bit hysterical about this one disease, which is contagious, it is dangerous, we need to take reasonable measures, but that we are not taking a proportionate response to this danger to us. What do you think of that?
No, I mean, a very interesting point. I mean, it's worth saying, by the way, I think that there's plenty of evidence that there's people who die with coronavirus where it's not recorded on the death certificate for all sorts of reasons. And so I think that the figures that we're getting are probably balancing out about right. I think there's also things you say that are legitimate, that we aren't going to eradicate this virus. People who talk about eradicating it, I think are wrong. The only way we can eradicate it is if and when we will get a vaccine, which I hope will not be that long off. And the key thing is to try and save lives and actually to protect the economy. You know, I'm from a part of the world where I would argue economically we've been worse hit than anywhere else. You know, something like 40% of the entire workforce in South Lakeland was on furlough. We had a 6-fold increase in unemployment. Tourism and hospitality, we're the biggest visitor destination outside London, but unlike London, our population is somewhat older and therefore much more at risk. So I don't say this lightly. The evidence is, though, if we carry on as we are, we'll end up with the Prime Minister, and we know what he's like, panicking into some kind of lockdown in 4 or 5 weeks' time, shutting the stable door after the horse has bolted again. What we're talking about is looking at the scientific advice and making a judgment, because politicians have to do that. But the wisest thing to do for health reasons and also for economic reasons is to see if you can push back the disease by a month or two to give us the time to be able to rebuild the economy. But I have to say...
Hold on a minute. Push the virus back a month or two. You're not pushing it back a month or two unless you are going into lockdown for at least a month. All you do...
Well, as we know, the incubation period is about 2 weeks. You do a 3-week circuit breaker lockdown, yes. Then what you've done...
It's already gone from 2 weeks to 3 weeks, hasn't it? It's already jumped to 3 weeks.
Well, I mean, that's what we've said. I mean, I think you have your half-term holiday and you put something either side of it. But I think that the crucial thing in all this...
Finish that point, Tim, because you're saying that then we've got a 3-week lag on deaths. So we're then talking 6 weeks. Look, this is the thing. The circuit breaker...
We're talking 3 weeks. And I mean, some people have said 2. I think given the incubation period is about 14 days, 2 weeks would be... And on 14 days, of course.
And what changes after that? So we come out of this miraculous circuit breaker lockdown, and suddenly we've got a totally competent test and trace system, and somehow we've got on top of it. You know as well as I do. Even look, Carl Hennigan, who knows a darn sight more about all of this than you or I do, professor of evidence-based medicine at Oxford University. He said yesterday there is no good evidence for a circuit breaker lockdown.
Well, there is, and Sage have provided it.
They haven't. The study they've provided is one that gives a computer model, which even the person who designed it says he thinks it's a bit dodgy himself.
This is where we get into the kind of the semantics of following the science or not following the science. In the end, we listen to experts, and politicians have to make a judgment. And anybody expected to be given a black and white outcome and just follow one is going to be very disappointed. So yes, we're not going to solve this, but it's a case of what does least harm. And it's very clear, I think. I mean, I'm confident, sadly, that if the Prime Minister doesn't take the advice of Sage and doesn't do what we're asking him to do, he'll end up doing something very like it in about a month or so's time when things are far worse. Except
Sage thought that at one point they believed the Professor Neil Ferguson Imperial College model that we would have up to 500,000 deaths. I mean, absolutely absurd modelling that's been totally debunked.
Well, we're all dealing with this as it unfolds, as it goes along. And this is why I think when the government, didn't do everything right, shall we say, February, March, April, that's much more excusable. We're all like rabbits in the headlight then. Things were
isn't it? And isn't it much more excusable to use a computer model as opposed to empirical evidence like Professor Carl Hennigan does? You said, but this is about saving lives, protecting the economy. We might save more lives from COVID, from people aged in their 80s who are already very, very unwell. We're not going to save more lives of people who don't get treated for cancer. We're not going to save more lives of people who are going to lose their jobs and commit suicide, are we?
I think there are people who would say just that. And I think it's incredibly callous. I think it also underestimates Britain's potential, because I'm absolutely convinced that the hidden outrage during this period is the shocking cancer backlog. Remember, we were meant to stay safe, stay at home, control the virus so that we could save and protect the NHS. What for? So the NHS could treat us and care for us for those conditions aside from COVID. And we've got 100,000 people undiagnosed. And this is because of a number of things, but largely because the government didn't take the action and still hasn't taken the action it needs to do to be able to tackle cancer diagnostics and cancer treatment. Now, to be fair, they've called in Professor Mike Richards, and on the cancer diagnostics, I think they're getting their act together. But on treatment, they are not. And the fact is, cancer waiting lists don't stay long forever because people die. And that is why the government needs to be doing really radical things. For instance, radiotherapy, which is the clean form of cancer treatment in the sense that it's non-invasive, it doesn't affect your immunity, should be ramped up, to use the government's phrase, almost exponentially. Okay. There should be satellite units placed at every district general hospital. That way we will save lives. I think the idea we've got to make a choice between COVID and cancer is not worth it.
Except that's exactly what we have done. We're going to have to leave it there. Time's against us. Tim Farron, really appreciate you joining us, a Liberal Democrat MP and former leader.